Back pain is one of the most common medical problems in the U.S. If you suffer with back pain, then you understand how painful it can be just doing simple everyday movements such as walking, running, bending over, or lifting things.
I was having extreme pain in my lower back, and I wasn't able to play sports the way I always had, and so I had to come into the doctor.
The highly trained and caring team at Texas Spine Consultants offer complete care of the spine, from simple concerns to complex issues. Their focus is to get you back to enjoying life and to what really matters.
Well, we're a three-man orthopedic spine group, and I think one of the unique things about our group is that we pretty much handle everything that goes on with the spine. Anything from minimally invasive procedures for spinal stenosis and disc protrusions to complex spinal deformities to tumors, infections, really the whole gamut of spine surgery.
The most common conditions that we see and treat are nerve compressions in the neck and in the lower back. We also see people who have all different kinds of spinal deformities. The most familiar to most people is scoliosis, but that's probably not the most common. The most common would be spondylolisthesis, where one bone and the next bone are out of position with respect to one another. And then we also see people who have instability, meaning that the bones are not moving in a normal relationship to one another.
By providing personalized non-surgical and surgical choices, as well as complete focus on their patients, puts them at the forefront as leaders in spine care.
Well, there's been a lot of advances in spine surgery. A lot of the surgical techniques allow a less invasive approach. Most importantly, I think the devices and instruments that we use during surgery are able to better accomplish what we need to do so that we can get a better correction of the deformity. We can have a more stable construct when we leave the operating room so that people can recover better and have a more successful overall healing of their fusion.
The things that are being done today, we can do them more minimally invasively. A lot of the implants that are available allow us to control the spine better, so we can get much better correction in our scoliosis than what we used to when we only had the availability of hooks and things. Now we can hook into each individual vertebrae and correct the position of each individual vertebrae separately, which is really helpful. And we have motion preservation technology, so for people who have a disc problem, but the rest of their joint structure is okay, we can do things like an artificial disc that allows that disc segment to still move normally without having to do a fusion.
After the surgery, how much it helped me was just tremendous. I don't know what it would have been like without having the surgery. I felt amazing. At first it was a little hard getting back into shape, but it was so worth it. I didn't feel the pain anymore. The only pain I felt was cramps from running. Getting back in shape, it was really hard. But after I got back in shape and started playing in the games and stuff, it was just amazing.
Texas Spine Consultants, helping your pain end so you can get back to your life.